Welcome back. Now, the battle against opioids, the crisis hitting the headlines again recently when singer Demi Lovato was rushed to the hospital last week after an apparent drug overdose. The singer was reportedly revived using the life-saving nasal spray Narcan. Lovato remains hospitalized this morning after reportedly suffering complications following the overdose. But joining me right now is the CEO of Opiant Pharmaceuticals and the inventor of Narcan, Dr. Roger Crystal. Dr. Crystal, great to see you.
Good morning.
Thank you so much for joining us. And what you've done in terms of inventing Narcan is just incredible. Tell us about this episode in particular, putting Narcan and the opioid crisis back in the headlines.
Thank you. So what happened to Demi Lovato is extremely unfortunate and really does depict what is happening now in this opioid crisis, which essentially is affecting all Americans. And what we're very fortunate for is that her friends apparently were carrying the Narcan nasal spray and therefore were able to revive her, provide the help in time. And what we ought to be doing, and it's the recommendation from the US Surgeon General, is that more and more people should be carrying naloxone, which the Narcan nasal spray is, so that help can be given as soon as someone overdoses.
So she had overdosed, she was unconscious, and one of her friends had the Narcan nasal spray. They gave it to her and it actually revived her. How does that work? How does the Narcan do that?
Narcan nasal spray has the drug naloxone inside it, and essentially it restores breathing. When you overdose on an opioid, what unfortunately happens is the body's automatic drive to breathe just gets eliminated. So you have to restore that as soon as possible to allow oxygen to get to the brain.
Now, that Lovato's overdose comes just a few months after the U.S. Surgeon General issued a national advisory urging more Americans to keep naloxone on hand and learn how to use it. This was the first Surgeon General's warning in 13 years. Has that helped with awareness?
I think it has, and what we're seeing in conjunction with that is stores such as CVS, Walgreens stocking Narcan nasal spray. We're seeing a lot better reimbursement. For example, Aetna announcing a $0 copay. But for us, what's important about us as a company is to not just think about the overdose, which is the saving a life, but how do you then develop more treatments to treat the underlying addiction? And that's something that we have in our pipeline with technologies such as a heroin vaccine, a long-acting implant, in order to try and really treat the underlying addiction long term.
So this is an opioid vaccine that you're working on. You think it's close to FDA approval?
Well, it's early stages. However, it's making good progress. We're very fortunate to have a fantastic partnership with the Walter Reed Medical Center, which is the extremely talented scientists at that facility who have developed this vaccine. We are working in conjunction to take it into the clinic.
So characterize where we are in the opioid crisis. I mean, this is coming as the use of prescription opioids still very high, right?
It's extremely high.
Yeah, and that's also, we need to make sure people are aware of this.
Indeed, and the opioid crisis, unfortunately, is just continuing to get worse. The most recent data show that 53,000 Americans died from opioid overdose deaths in 2016, but the most concerning part of this, Maria, is actually that almost half of those opioid deaths contained fentanyl. Fentanyl is a more powerful version of heroin in many ways, 50 times stronger.
Wow.
It lasts about 7 hours, so there's a real risk that someone can be revived, but then go back into overdosing. And that's why we as a company are actually working on a longer-acting opioid overdose product, a nasal nalmefene, that we think we can file for approval in 2020.
Wow. And there's new research that says that doctors are still prescribing as many opioid painkillers as they were 10 years ago. So, I mean, you're still seeing the kind of prescriptions that are coming out of doctors' offices, even with this crisis. I mean, why hasn't education and awareness helped that?
It's going to take a long time. I mean, this crisis has been over a decade in the making, and unfortunately, to unravel that and to work on this is going to start with what we need to be doing in medical schools, educating medical students not to be using opioids in such a liberal fashion. In the US, it's interesting that an opioid is often the first painkiller that a doctor will use for pain relief. I'm from the UK originally. I'm living in California now. But when I was working as a surgeon, typically the first type of painkiller I would be using is something like ibuprofen, even for something that's reasonably painful like tonsil surgery. So we need to just start from bottom up and work that way.
So characterize for us how this happens. I mean, a doctor prescribes an opioid for pain medication, and what happens? And how often does it happen that someone just gets addicted and then reaches for more and more?
In general, the higher the dose of an opioid you're prescribed, the longer you get prescribed it for, and then the more you take it, you dramatically increase the likelihood of being addicted. What we don't know, there's no genetic test out there yet to determine, well, who might be at higher risk of becoming addicted. What we do know, though, is who's at higher risk of potentially overdosing. So typically older people, people taking those longer prescriptions, people who, for example, about 30% of people who are taking opioids are also taking some form of sleeping pills as well. So you can imagine the combination can become very, very dangerous.
And when the opioids go away, that the doctor says, okay, you don't need this anymore, then they're addicted already.
Absolutely.
So then they reach for heroin or fentanyl, like you said.
That's what we're seeing,
yeah.
is that indeed. So, as you say, fentanyl is unfortunately the most dangerous and concerning because it's actually cheaper and easier to make than heroin. So that's why we've seen this evolution from heroin to a fentanyl overdose in the last couple of years.
Really fascinating. We'll be watching what you're up to next. Dr. Roger Crystal, thanks very much.
Thank you.
We appreciate it.